Question are HEC regulations and standards. The Health and Care Professions Council (HEC) requires registered professionals to adhere to specific standards of conduct, performance, and ethics. These standards include maintaining patient confidentiality, working within one's scope of practice, and ensuring continuous professional development. Which of the following is the most important reason for HEC's role in establishing these standards? A. To ensure that professionals can be held accountable for their actions in healthcare settings. B. To ensure that healthcare professionals maintain balanced work-life relationship. C. To ensure that healthcare professionals receive adequate remuneration for their services. D. To monitor and control the hours worked by healthcare professionals. Answer A. To ensure that professionals can be held accountable for their actions in healthcare settings. Explanation. HCPC's primary role in setting standards for conduct, performance, and ethics is to protect the public by ensuring that healthcare professionals are accountable for their actions and provide safe and effective care. These standards help ensure that professionals meet specific competence thresholds, act ethically, and comply with regulations like safe confidentiality and patient rights. While remuneration and work-life balance are important considerations, they are outside the scope of HEC's regulatory framework. Monitoring working hours is also not part of the HEC's direct responsibility. Therefore, the correct answer is because accountability is the central purpose of these standards. Question 2. Legal and ethical framework. In the context of informed consent, a healthcare professional is required to ensure that a patient has the capacity to make decisions about their own care. Which of the following is true about a patient's capacity to consent under UK law? A. Patient who is unable to understand the nature of the decision being made cannot provide valid consent even if they are informed about the treatment options. B. Patient can provide valid consent if they are informed, regardless of their understanding of the treatment's risks and benefits. C. Patient's capacity to consent is automatically assumed if they are over the age of 18. D. Patient's refusal of treatment cannot be considered valid if they're under the age of 18. Answer A. A patient who is unable to understand the nature of the decision being made cannot provide valid consent even if they are informed about the treatment options. Explanation. Under UK law, a patient's capacity to consent is a fundamental principle of medical ethics and legal practice. For consent to be valid, the patient must have the mental capacity to understand the nature of the treatment, its purpose, risks, and benefits. If the patient is unable to understand this, even if informed, the consent cannot be considered valid. The legal test for capacity focuses on the ability to understand, retain, and weigh information relevant to the decision. Consent is not automatically granted just because patient is over the age of 18. Option C. Informed consent also does not bypass the patient's understanding of risks and benefits. Option B. The refusal of treatment by minor. Option D can still be valid depending on their understanding and maturity, though this can vary based on the legal framework and the specific context. Question 3. Scenario-based question. Professional practice and ethics. Mr. Smith, a registered physiotherapist, is treating a 35-year-old patient who has been experiencing persistent knee pain. After conducting an assessment, Mr. Smith recommends a treatment plan involving manual therapy and a series of exercises. However, the patient expresses concerns about the effectiveness of manual therapy, citing a prior negative experience with it. The patient insists on trying a different form of treatment, which Mr. Smith believes is less effective. What should Mr. Smith do in this situation according to HEC standards of professional conduct? Mr. Smith should insist on the prescribed treatment because it is the most evidence-based approach and is in the best interest of the patient. B. Mr. Smith should dismiss the patient's concerns as the patient's prior experience with manual therapy is irrelevant. C. Mr. Smith should work collaboratively with the patient to discuss alternative treatment options and respect the patient's preferences while considering the clinical evidence. D. Mr. Smith should refer the patient to another physiotherapist who might be more agreeable to the patient's treatment preference. Answer. C. Mr. Smith should work collaboratively with the patient to discuss alternative treatment options and respect the patient's preferences while considering the clinical evidence. Explanation. In line with HEC's standards for professional practice, healthcare professionals are required to work collaboratively with patients, respecting their preferences and values while still providing evidence-based care. In this scenario, Mr. Smith should listen to the patient's concerns and explain the evidence supporting the recommended treatment plan while also exploring and discussing any viable alternative treatments that the patient may feel more comfortable with. This approach supports patient-centered care, which is integral to professional practice standards, including patient autonomy and respect for diversity. Dismissing the patient's concerns, option B, or insisting on treatment plan without consideration for the patient's preference, option A, would violate these standards. Referring the patient to another professional, option D, may not be necessary, as Mr. Smith can address the situation through open communication and shared decision-making. Question 4. Safeguarding and risk management. In a healthcare setting, a nurse notices signs of potential abuse in a patient who is unable to speak due to a neurological condition. The patient exhibits unusual bruising and seems distressed when approached. What is the nurse's primary responsibility in this situation under GC standards? A. The nurse should document the observations and continue to monitor the patient for further signs of abuse. B. The nurse should report the concerns to the safeguarding lead or relevant authority immediately following appropriate protocols. C. The nurse should attempt to address the patient's distress directly by asking them about the cause of their bruising. D. The nurse should inform the patient's family members and discuss the situation with them before taking further action. Answer. B. The nurse should report the concerns to the safeguarding lead or relevant authority immediately following appropriate protocols. Explanation. DSHEC guidelines. Safeguarding is a key responsibility for all healthcare professionals, especially when there is a suspicion of abuse or neglect. In this scenario, the nurse is required to report the concerns to the safeguarding lead or relevant authority immediately following the established safe protocols. This ensures that the appropriate actions are taken to protect the vulnerable patient. Documenting the observations, option A, is important but should not delay reporting to the safeguarding authorities. Directly questioning the patient, option C, may not be appropriate if the patient cannot communicate effectively, and informing family members, option D, could potentially compromise the patient's safety if abuse is suspected. Question 5. Clinical competence and proficiency. A healthcare professional is assessing a patient's condition and is uncertain about the appropriate intervention to apply. According to GC standards, what should the healthcare professional do? A. The healthcare professional should proceed with their usual practice as they are experienced in this type of condition. B. The healthcare professional should consult with a more senior colleague or supervisor to ensure they are making the right decision. C. The healthcare professional should refer the patient to another specialist without seeking any guidance from their team. D. The healthcare professional should document the uncertainty and move forward with their preferred course of action. Answer. B. The healthcare professional should consult with a more senior colleague or supervisor to ensure they are making the right decision. Explanation. According to HCPC standards of proficiency, healthcare professionals must demonstrate clinical competence and the ability to seek appropriate guidance when faced with uncertainty. In this scenario, the professional should seek advice from senior colleague or supervisor to ensure that they are providing the best care for the patient. The decision to proceed without consulting others, option A, or to refer the patient without seeking input, option C, would not align with the standards for collaborative decision-making and professional competence. Documenting uncertainty, option D, without seeking guidance could lead to suboptimal care. Question 6. Fitness to practice. A social worker is informed that a colleague has been engaging in inappropriate behavior with a vulnerable client. What is the correct course of action for the social worker according to GPC's fitness to practice procedures? A. The social worker should confront the colleague privately and discuss the allegations with them. B. The social worker should report the incident to the relevant authorities or professional body immediately. C. The social worker should ignore the situation as it is not their responsibility. D. The social worker should wait until further evidence is gathered before making any decisions. Answer. B. The social worker should report the incident to the relevant authorities or professional body immediately. Explanation. Under HCPC's fitness to practice procedures, professionals are required to report any concerns regarding the fitness to practice of colleague immediately. The health and safety of the patient or client is paramount, and failure to report concerns may result in harm or further unethical behavior. Confronting the colleague privately, A, could allow the behavior to continue and does not comply with the ethical duty to protect vulnerable individuals. Ignoring the situation, option C, or delaying action, option D, is not in line with the professional standards and responsibilities set out by HCE. Question 7. Professional practice and ethics. A healthcare practitioner is working in A multidisciplinary team and encounters a situation where another team member proposes a course of action that conflicts with the practitioner's professional values. What should the practitioner do in this situation according to GC standards? A. The practitioner should accept the decision without expressing disagreement as it is team decision. B. The practitioner should discuss the concerns with the team in respectful and constructive manner, aiming for collaborative solution. C. The practitioner should avoid further involvement and let the team member handle the decision on their own. D. The practitioner should immediately report the colleague's proposed course of action to the relevant professional body. Answer. B. The practitioner should discuss the concerns with the team in a respectful and constructive manner, aiming for a collaborative solution. Explanation. AEC standards emphasize the importance of collaboration and respectful communication within multidisciplinary teams. If a healthcare practitioner has ethical concerns or disagreements with a proposed course of action, it is their responsibility to voice these concerns constructively within the team to find a mutually agreed upon solution, avoiding the issue, option C, or immediately reporting the colleague, option D, without attempting to resolve the conflict within the team would not align with the expectation for professional behavior. Accepting decisions without discussion, or A, could lead to compromised patient care and ethical violations. Question 8. Regulatory compliance. A physiotherapist is aware that a colleague is repeatedly failing to meet the documentation standards required by the HCC. What should the physiotherapist do in this situation? A. Ignore the issue, as it is the colleague's responsibility to ensure their own documentation is accurate. B. Report the issue to the HCC immediately, as documentation failure is a serious breach of regulations. C. Discuss the matter privately with the colleague, offering guidance on how to improve their documentation. D. Discuss the matter with the team manager to seek resolution before taking any further action. Answer. D. Discuss the matter with the team manager to seek a resolution before taking any further action. Explanation. According to HCC standards, when a healthcare professional becomes aware of a colleague's non-compliance with documentation standards, the most appropriate first step is to address the issue with the team manager. This allows the organization to take action and address the issue promptly, ignoring the problem, option A, or directly report HCC, option B, without giving the opportunity for internal resolution would not align with the process for managing professional standards. While discussing the issue privately with the colleague, option C, may be useful. Involving the team manager ensures that the matter is dealt with at an appropriate organizational level. Question 9. Health and care professions specific skills. Paramedic is treating critically ill patient who requires rapid intervention, and the team has access to new digital health tool to assist in patient assessment. According to HCC standards, what should the paramedic do before using this new tool? A. Use the tool immediately, as it is modern technology and can enhance the speed of care. B. Ensure that the paramedic has received proper training on how to use the tool effectively and safely before using it. C. Use the tool without training, as it is easy to use and does not require any prior knowledge. D. Wait for another paramedic who has experience with the tool to arrive and take over the task. Answer. B. Ensure that the paramedic has received proper training on how to use the tool effectively and safely before using it. Explanation. HCC standards for professional practice require healthcare professionals to be competent in the use of any tools, technologies, or techniques relevant to their practice. Before using any new technology, the paramedic must ensure they have received appropriate training to use the tool safely and effectively. Using a new without training, option C, could lead to errors in patient care and compromise patient safety. Waiting for a more experienced colleague, option D, may delay critical care, and using the tool immediately, option A, without training would violate professional competence standards. Question 10. Clinical supervision and mentorship. A new healthcare professional is struggling to adapt to the demands of their role, and their clinical supervisor is providing regular feedback. What is the key role of the supervisor in this situation according to HCC standards? A. The supervisor should provide criticism of the healthcare professional's performance without offering solutions. B. The supervisor should provide supportive feedback, offer guidance on improving performance, and monitor progress. C. The supervisor should delegate all responsibility to other team members to avoid additional pressure on the new healthcare professional. D. The supervisor should avoid giving feedback to avoid demotivating the healthcare professional. Answer. B. The supervisor should provide supportive feedback, offer guidance on improving performance, and monitor progress. Explanation. According to HEC standards, clinical supervision is an essential part of professional development, and supervisors are expected to offer constructive and supportive feedback to help healthcare professionals improve their performance. Supervisors must provide clear guidance and offer strategies for improvement while monitoring progress. Simply criticizing the professional, option A, without offering solutions is not effective. Delegating responsibility, option C, or avoiding feedback, option D, would not align with the role of the supervisor in supporting professional growth and ensuring quality care. Question 11. Professional accountability. A healthcare professional makes an error during a procedure that could potentially harm a patient. What is the most appropriate course of action according to HEC standards? A. The healthcare professional should immediately inform the patient and report the error to their supervisor. B. The healthcare professional should avoid telling the patient and instead document the error for future reference. C. The healthcare professional should wait until the patient shows signs of harm before taking action. D. The healthcare professional should deny the error if no immediate harm is evident. Answer A. The healthcare professional should immediately inform the patient and report the error to their supervisor. Explanation. HEC standards emphasize that healthcare professionals must be accountable for their actions and should take immediate steps to rectify errors. In this case, the healthcare professional should be transparent with the patient, informing them of the error, and should report the incident to their supervisor for proper handling. Avoiding the error or waiting for harm to occur, options B and C, are not acceptable and may lead to further issues. Denying the error, option D, goes against ethical and professional responsibilities. Question 12. Confidentiality and data protection. A healthcare worker is approached by a family member of a patient requesting sensitive information about the patient's condition. According to HEC guidelines, what should the healthcare worker do? A. Disclose the information if the family member insists, as they are a relative of the patient. B. Refer the family member to the patient, as only the patient can provide consent. C. Disclose the information only if the family member provides written consent from the patient. D. Inform the family member that confidentiality laws prevent any sharing of information and refer them to the appropriate authority. Answer. C. Disclose the information only if the family member provides written consent from the patient. Explanation. At HEC standards, confidentiality is a critical component of professional conduct. Information about a patient should only be shared with third parties, including family members, if the patient has given explicit consent, preferably in writing. Simply relying on the family relationship, option A, is not sufficient, as patient confidentiality must be respected regardless of family ties. Referring the family member to the patient, option B, is a good practice, but without written consent, the healthcare worker cannot legally disclose information. Question 13. Continuing professional development, e.e. A registered healthcare professional is required to maintain their registration with the ATC. What is the most important reason for engaging in continuous professional development? CPD. CPD is only required for newly registered healthcare professionals to maintain their qualification. B. CPD ensures that the healthcare professional remains informed about the latest advancement, their field, maintaining competency and improving patient care. C. CPD is required to comply with external regulatory bodies and is not directly relevant to patient care. D. CPD is optional as long as the healthcare professional has completed their initial training. Answer. The CPD ensures that the healthcare professional remains informed about the latest advancements in their field, maintaining competency and improving patient care. Explanation. Engaging in CPD, a core expectation at HEC guidelines, it ensures that healthcare professionals continue to develop their skills, knowledge, and competence throughout their careers, which directly benefits patient care. CPD is necessary for maintaining registration. Its primary purpose is to support professional growth and improve care rather than simply fulfilling regulatory requirements, option C, or meeting initial qualification requirements, options and D. Question 14. Cultural competence and diversity. A healthcare worker is providing care to a patient from a different cultural background, and the patient expresses discomfort with certain aspects of the proposed treatment plan. What is the appropriate response according to HEC standards? A. The healthcare worker should insist that the patient follows the prescribed treatment plan as it is medically necessary. B. The healthcare worker should disregard the patient's concerns as cultural factors are not relevant to the medical treatment. C. The healthcare worker should respect the patient's cultural preferences and engage in discussion to explore alternatives that align with both cultural and medical needs. D. The healthcare worker should refer the patient colleague of the same cultural background to address the concerns. Answer: C. The healthcare worker should respect the patient's cultural preferences and engage in discussion to explore alternatives that align with both cultural and medical needs. Explanation: HEC standards emphasize cultural competence in healthcare practice, which involves respecting and understanding the diverse backgrounds of patients. The healthcare worker should engage in respectful discussion with the patient, acknowledging their cultural preferences while exploring treatment options that align with both medical needs and cultural values. Ignoring the patient's concerns, option B, or insisting on the prescribed treatment without considering the patient's preferences, option A, could lead to ineffective care and breakdown in trust. Referring the patient to colleague based solely on cultural background, option D, may not address the root of the issue and is not the ideal approach. Question 15. Interprofessional collaboration. A physiotherapist is working with an interdisciplinary team and there is disagreement about the best treatment approach for a patient with complex needs. What is the appropriate response at HEC guidelines? A. The physiotherapist should assert their approach as the only valid treatment, as they are the expert in their field. B. The physiotherapist should engage in open, collaborative discussion with the team to reach a consensus on the best approach for the patient. C. The physiotherapist should defer entirely to the opinions of the medical doctors, as they have the final say. D. The physiotherapist should take no action and allow the patient to make their own decisions. Answer: B. The physiotherapist should engage in open, collaborative discussion with the team to reach a consensus on the best approach for the patient. Explanation: HEC standards highlight the importance of interprofessional collaboration. Healthcare professionals are expected to work together effectively, drawing on each other's expertise to develop the most effective treatment plan for the patient. Open, respectful discussions and reaching consensus, option B, are the best approach. Assertively pushing one's own approach, option A, or deferring entirely to others, option C, without collaboration would not foster the teamwork necessary for optimal patient care. Allowing the patient to make their own decisions, option D, may not be appropriate when the patient's needs are complex and require professional expertise. Question 16. Professional conduct and ethical decision-making. A healthcare professional is asked by their manager to complete a task that they believe to be outside their scope of practice. What should the healthcare professional do according to HCC standards? A. The healthcare professional should complete the task as instructed, as the manager is in charge. B. The healthcare professional should refuse to do the task but not inform the manager about their concerns. C. The healthcare professional should complete the task but document their concerns about the task in their records. D. The healthcare professional should inform their manager of the concern, seek guidance, and refuse to perform the task if it is outside their competence. Answer: D. The healthcare professional should inform their manager of the concern, seek guidance, and refuse to perform the task if it is outside their competence. Explanation: HEC standards emphasize that healthcare professionals must work within the limits of their competence and only undertake tasks they are qualified to perform. If a healthcare professional is asked to perform a task outside their scope, they should raise the concern with their manager and seek guidance. To perform the task is acceptable, but doing so in a professional manner with proper communication is crucial. Completing the task despite concerns, option A, not informing the manager, option B, or documenting concerns without addressing them, option C, are not aligned with professional standards and could compromise patient safety. Question 17. Confidentiality and data protection. A healthcare worker is preparing to share patient information with a team member who will be handling the patient's follow-up care. What must the healthcare worker ensure before sharing this information? A. The healthcare worker must ensure that the information is shared in person and not electronically to avoid data breaches. B. The healthcare worker must ensure that the team member has the appropriate professional role to access the information and that confidentiality is maintained during the transfer. C. The healthcare worker can share the information with any team member regardless of their role as long as it is for patient care. D. The healthcare worker can share the information without any precautions as it is for the benefit of the patient's care. Answer: B. The healthcare worker must ensure that the team member has the appropriate professional role to access the information and that confidentiality is maintained during the transfer. Explanation HEC standards require healthcare professionals to ensure that patient information is only shared with those who have a legitimate need to know based on their professional role. Confidentiality must be maintained, regardless of whether the information is shared electronically, person, or through other means. Simply sharing information with any team member, regardless of their role, option C, or without precautions, option D, violates confidentiality standards. Ensuring appropriate access and maintaining confidentiality during the transfer, option B, is the correct approach. Question 18. Fitness to practice and disciplinary processes. A healthcare professional is suspected of being impaired due to substance misuse. What is the most appropriate course of action according to HEC standards? A. The healthcare professional should be allowed to continue working without investigation as their impairment is a private matter. B. The healthcare professional should be referred to HEC for a fitness to practice investigation. C. The healthcare professional should be removed from direct patient care but allowed to continue in other non-clinical roles. D. The healthcare professional should be immediately dismissed from their position without further investigation. Answer. B. The healthcare professional should be referred to HCC for a fitness to practice investigation. Explanation. At HEC standards, any concerns about a healthcare professional's fitness to practice, including issues related to substance misuse, must be reported to the ATC for investigation. The HCC has legal obligation to ensure that professionals are fit to practice and protect public safety, allowing the individual to continue practicing without investigation, option A, or without appropriate measures, option C, is not in line with the regulatory requirements. Immediate dismissal, option D, should not be the first course of action, as due process is necessary. Question 19. Risk management and safeguarding. A healthcare professional notices signs of potential abuse in a vulnerable patient. According to TC guidelines, what is the healthcare professional's responsibility? A. The healthcare professional should ignore the signs unless the patient explicitly reports abuse. B. The healthcare professional should report their concerns to the appropriate safeguarding body and document the observations. C. The healthcare professional should try to address the situation privately with the patient before reporting. D. The healthcare professional should assume the abuse is misunderstanding and take no further action. Answer. B. The healthcare professional should report their concerns to the appropriate safeguarding body and document the observations. Explanation. HEC guidelines emphasize the responsibility of healthcare professionals to act when they suspect abuse or neglect, even if the patient has not explicitly reported the issue. Reporting concerns to the appropriate safeguarding body and documenting observations is essential for patient protection and legal compliance. Ignoring the signs, option A, or assuming it is a misunderstanding, option D, is a failure to act in the best interests of the patient. Addressing the situation privately with the patient, option C, may not be appropriate and could jeopardize the patient's safety, particularly in situations of abuse. Question 20. Clinical supervision and mentorship. A newly registered healthcare professional is struggling to integrate into a multidisciplinary team. What is the most effective way to support this individual according to HEC standards? A. Ignore the issue, as the new professional should figure out the dynamics on their own. B. Provide regular clinical supervision and mentorship to address any concerns, encourage team integration, and facilitate learning. C. Give the new professional a set of written guidelines and expect them to follow it without additional support. D. Replace the individual with another professional who has more experience working in teams. Answer. B. Provide regular clinical supervision and mentorship to address any concerns, encourage team integration, and facilitate learning. Explanation. AEC standards highlight the importance of mentorship and clinical supervision in supporting professional development, particularly for new healthcare professionals. Regular supervision and guidance help integrate the individual into the team and provide the necessary support to address any concerns. Ignoring issue, option A, or providing only written guidelines, option C, does not offer sufficient guidance or hands-on support. Replacing the individual, option D, is not a solution and may fail to address the underlying challenges that could be overcome with the right support. Question 21. Professional boundaries and patient relationships. A healthcare professional is treating a patient who expresses a desire to maintain a personal friendship after treatment ends. According to HEC guidelines, how should the healthcare professional handle this request? A. Agree to the request as it would help in building trust and rapport with the patient. B. Politely refuse the request, explaining the importance of maintaining professional boundaries. C. Agree to the request if the patient has been a long-term client. D. Ignore the request and continue treatment as usual without addressing the matter. Answer: B. Politely refuse the request, explaining the importance of maintaining professional boundaries. Explanation: HEC guidelines emphasize the importance of maintaining professional boundaries between healthcare professionals and patients to ensure objective, effective care. Building a personal relationship with a patient, option A, or agreeing to this request based on their history with the professional, option C, can undermine the professional role and may lead to conflict of interest or compromised patient care. Ignoring the request, option D, is also inappropriate as it fails to address the potential risk of boundary violations. The correct response, option B, ensures professionalism is maintained and patient care remains at the forefront. Question 22. Clinical competence and lifelong learning. A healthcare professional has completed their mandatory training but has not participated in any additional learning for over a year. What is the most appropriate action for this professional to take to MHEC standards? A. They are not required to engage in further training until their next performance review. B. They should seek out and engage in continuing professional development (CPD) activities to ensure their skills and knowledge are up to date. C. They should rely on their previous knowledge and experience as they are not required to learn new information. D. They should request to be reassigned to a non-clinical role to avoid the need for further training. Answer: B. They should seek out and engage in continuing professional development (ED) activities to ensure their skills and knowledge are up to date. Explanation: HEC standards require healthcare professionals to engage in continuing professional development (CPD) to maintain their competence. Even if the mandatory training is complete, professionals are expected to participate in ongoing learning to keep their skills current. Relying solely on previous knowledge, option C, or avoiding additional learning by changing roles, option D, would not meet HEC standards for professional development. CPD is essential to ensuring that healthcare professionals are equipped to provide the best possible care. Question 23. Ethical decision-making and professional judgment. A healthcare professional is faced with a situation where providing a patient with treatment could potentially cause harm, but it is the only option available to improve their condition. What should the healthcare professional do in this situation according to HEC ethical guidelines? A. Provide the treatment as it is the only option to improve the patient's condition regardless of the potential harm. B. Withhold the treatment and seek alternative methods even if they are less effective. C. Discuss the potential risks and benefits with the patient, obtain informed consent and proceed with the treatment if the patient agrees. D. Ignore the ethical dilemma and proceed with the treatment without discussing it with the patient. Answer: C. Discuss the potential risks and benefits with the patient, obtain informed consent, and proceed with the treatment if the patient agrees. Explanation: HEC guidelines emphasize the importance of ethical decision-making, especially when there is a risk of harm. In this scenario, the healthcare professional must engage in a process of informed consent. This involves discussing the potential risks and benefits of the treatment with the patient, ensuring that they understand their options and respecting their autonomy in making the final decision, option C. Simply providing the treatment without consent, option A, or withholding it without proper discussion, option B, would not align with HEPC's ethical standards. Ignoring the ethical dilemma, option D, could lead to professional misconduct and legal repercussions. Question 24. Informed consent and capacity to consent. A healthcare professional is treating a patient who is unable to communicate verbally due to a medical condition but can understand simple instructions. What is the healthcare professional's responsibility in obtaining informed consent? A. The healthcare professional can proceed with treatment without obtaining informed consent, as the patient cannot communicate verbally. B. The healthcare professional should assume the patient consents due to their ability to understand simple instructions. C. The healthcare professional should assess the patient's capacity to consent and, if appropriate, seek consent from legal representative or family member. D. The healthcare professional should wait until the patient is communicate verbally before proceeding with any treatment. Correct answer: C. The healthcare professional should assess the patient's capacity to consent and, if appropriate, seek consent from legal representative or family member. Explanation: informed consent is fundamental principle in healthcare. HEC guidelines require healthcare professionals to assess the patient's capacity to consent. In cases where patient cannot communicate verbally, the professional should assess their ability to understand and make decisions about treatment. Option C. If the patient is unable to give consent due to their condition, the professional must seek consent from legal representative or family member, ensuring that the patient's rights and autonomy are respected. Proceeding without consent. Option A. Assuming consent based on limited understanding. Option B. Or delaying treatment unnecessarily. Option D. Could violate legal and ethical standards. Question 25. Safeguarding vulnerable patients. A healthcare professional notices that a patient under their care appears to be showing signs of neglect, including poor hygiene and malnutrition. What is the healthcare professional's first step according to CC safeguarding guidelines? A. Ignore the signs, as neglect is not their responsibility to address. B. Confront the patient directly about the suspected neglect. C. Document the signs and report the concerns to the appropriate safeguarding authority for further investigation. D. Contact the patient's family members and ask them to address the issue. Answer: C. Document the signs and report the concerns to the appropriate safeguarding authority for further investigation. Explanation: HEC safeguarding guidelines mandate that healthcare professionals must take immediate action when they suspect neglect or abuse. The first step should be to document the signs and report the concerns to the appropriate safeguarding authority, as this allows for a thorough investigation and ensures the patient's safety. Ignoring this, option A, or confronting the patient directly, option B, is inappropriate and could harm the patient further, while contacting family members, option D, may be helpful. In some cases, it is not substitute for reporting to safeguarding authorities, especially when immediate action is required to protect the patient. Question 26. Duty of care and safeguarding vulnerable individuals. A healthcare professional is working with a vulnerable elderly patient who has a history of dementia. The patient expresses concern about their medication being changed without their consent, but the professional knows that the change is medically necessary. What should the healthcare professional do? A. Ignore the patient's concerns and proceed with the treatment as prescribed by the physician. B. Explain the reasons for the change in medication, ensuring that the patient understands and seek their consent where possible. C. Proceed with the medication change without further discussion, as the patient's dementia makes it difficult for them to understand. D. Contact the patient's family members and proceed with the medication change without involving the patient in decision. Answer: B. Explain the reasons for the change in medication, ensuring that the patient understands and seek their consent where possible. Explanation: at HEC guidelines, healthcare professionals have a duty of care to respect the autonomy of their patients, including those with dementia. Although the patient may not fully understand, the professional must explain the reasons for the change in medication in a way that the patient can comprehend. Seeking consent possible. Option B. Ignoring the patient's concerns, option A, or assuming the patient cannot understand, option C, violates their right to participate in decisions regarding their treatment. While involving family members, option D, can be part of the process. It should not replace direct communication with the patient when possible. Question 27. Professional accountability and responsibility. A healthcare professional is aware that a colleague has made a clinical error during a procedure that has not yet been reported. What should the healthcare professional do according to HEC standards of accountability? A. Ignore the error, as it is not their responsibility to report a colleague's mistake. B. Report the error to the appropriate authorities immediately, ensuring that the patient's safety is not compromised. C. Discuss the error with the colleague and let them decide whether to report it. D. Attempt to fix the error themselves without notifying anyone. Answer: B. Report the error to the appropriate authorities immediately, ensuring that the patient's safety is not compromised. Explanation: HEC guidelines require healthcare professionals to act in the best interest of the patient and ensure that any errors, whether made by themselves or colleague, are reported and addressed. Ignoring the error, option A, or attempting to handle it personally, option D, undermines patient safety and the professional's responsibility. Discussing the issue with the colleague, option C, may be part of constructive approach. The primary responsibility lies in ensuring that the error is addressed through the proper channels to prevent harm and ensure patient safety. Option B. Question 28. Clinical negligence and liability. A healthcare professional provides a patient with an incorrect diagnosis which leads to unnecessary treatment. The patient later suffers from adverse effects as a result of this treatment. What is the healthcare professional's legal responsibility in this case? A. The professional is not liable as they were simply following established medical procedures. B. The professional is liable for clinical negligence as the incorrect diagnosis led to unnecessary treatment and harm. C. The professional is only liable if the patient can prove intentional harm. D. The professional is only liable if the patient can show that the treatment caused lasting damage. Answer: B. The professional is liable for clinical negligence as the incorrect diagnosis led to unnecessary treatment and harm. Explanation: HEC standards require healthcare professionals to provide accurate diagnoses and appropriate treatments. Clinical negligence occurs when a professional's failure to meet established standards results in harm to the patient. In this case, the professional's incorrect diagnosis led to unnecessary treatment and subsequent harm to the patient, which constitutes clinical negligence. Option B. Simply following procedures. Option A does not absolve the professional of responsibility if the treatment was inappropriate or incorrect. Liability does not depend on intentional harm. Option C, or the permanence of the damage. Option D, but on whether the actions led to harm that could have been avoided with proper care. Question 29. Confidentiality and data protection. A healthcare professional accidentally discovers that a colleague's patient is receiving treatment for highly confidential condition. The professional is not involved in the patient's care and has no reason to know about this information. What should the healthcare professional do? A. Share the information with other colleagues, as it may be relevant to their practice. B. Ignore the information, as it is not their responsibility to protect someone else's confidentiality. C. Report the breach of confidentiality to the relevant authorities and refrain from discussing the condition with anyone else. D. Discuss the condition with the patient's family to ensure that they are aware of the situation. Answer: C. Report the breach of confidentiality to the relevant authorities and refrain from discussing the condition with anyone else. Explanation: AEC standards emphasize the importance of confidentiality and the protection of patient information. If a healthcare professional becomes aware of confidential information inadvertently, such as learning about a colleague's patient, they have a responsibility to report any potential breach of confidentiality. C. Sharing the information with others. Option A, or ignoring the breach. Option B, would violate the patient's privacy rights and the professional's ethical obligations. Discussing the condition with the family. Option D, is inappropriate unless authorized, as it further compromises confidentiality. Question 30. Ethical dilemmas in healthcare delivery. A healthcare professional is working in an emergency department when two patients arrive simultaneously. One patient requires urgent surgery but has no family to give consent, while the other has an immediate need for palliative care and has expressed wishes not to be resuscitated. What should the healthcare professional prioritize according to HEC ethical guidelines? A. Prioritize the patient needing surgery as it is a life-threatening situation. B. Prioritize the patient needing palliative care as they have already expressed their wishes. C. Provide equal attention to both patients and delay both treatments until family consent is obtained. D. Prioritize neither patient as the healthcare professional should seek guidance from a supervisor. Answer: B. Prioritize the patient needing palliative care as they have already expressed their wishes. Explanation: HEC ethical guidelines stress the importance of respecting a patient's expressed wishes and autonomy even in life-threatening situations. In this case, the patient needing palliative care has already expressed their wishes not to be resuscitated, and these wishes should be prioritized and respected. Option B, while the surgical patient's needs. Urgent healthcare professionals must ensure that they consider patient autonomy in decisions, particularly when advanced directives have been made. Delaying both treatments. Option C, or seeking supervisor guidance. Option D, is not suitable in such an emergency context. Prioritizing the surgery alone. Option A, without regard for the patient's expressed wishes, would be unethical.